All right, let's get going. So, welcome everyone to our webinar today, brought to you by our Sydney Organising Committee. We're going to be talking about excellence in social impact measurement and honest conversation about what it takes. I'm Laura Glynn, I'm Sydney's Executive Officer, and I'm super excited that we're all here today to hear more from the winners of last year's Excellence in Social Impact Measurement Award for Purpose Evaluations and Guide Dogs. Before we get going, I'd like to acknowledge the traditional custodians of country throughout Australia and their continuing connection to land, sea and community. We pay our respects to them and their cultures and to elders past and present. And just before I hand over, I'd just like to share a little bit about CIMNA for those of you who are new. We're a knowledge sharing network for social impact measurement in Australia. We bring together people from all types of organisations, not-for-profits, corporates, social enterprises, funders and government to drive social and environmental impact into the core of organisations and decisions. We do this through learning and networking events, which take place in person and online, our awards programme and training and accreditation. So if you want to learn more or sign up as a member, then please check out our website. Now pleased to hand over to Eleanor from our Sydney Organising Committee and For Purpose Evaluations to share some more background.
Hello everyone, thank you Laura for that introduction and welcome everyone to the webinar. I'm here to introduce or give a little bit of background around Guide Dogs Australia and For Purpose Evaluations and the project more generally before we jump into a panel discussion. So hello, I'm Eleanor. I'm the director and founder of For Purpose Evaluations. FPE is a social enterprise that works with not-for-profits and governments to create and implement ways of measuring and communicating social impact, something that everyone here today is interested in. So we work hard to ensure that our frameworks complement existing service design and programs rather than compromise them. So the majority of our team at FPE, including myself, have worked in community services before finding our way to the world of impact measurement. So this real world experience helps us bring a pragmatic and empathetic lens to the work that we do. And this is something that I hope you'll see evidence of in the upcoming conversation that you've joined to hear about. So to introduce a slightly more well-known organisation, Guide Dogs Australia brings together 4 separate organisations. So they are Guide Dogs New South Wales and ACT, Guide Dogs Queensland, Guide Dogs South Australia and Northern Territory, and Guide Dogs Victoria. So 3 of these 4 organisations are with us today. Sadly, Guide Dogs South Australia Northern Territory is unable to make the panel discussion, but it's really important to note and recognise their contributions and involvement in the project over the years. So Guide Dogs exists to support people with low vision or blindness to live the life they choose. They provide a wide range of client services, including occupational therapy, orientation and mobility, and of course, the guide dogs themselves. They also undertake research, disability advocacy work, and community education. All of this wonderful work is funded through NDIS packages as well as generous philanthropy. So Guide Dogs Australia successfully applied for a grant to support their social impact work. In 2022, they engaged FPE to develop a national social impact measurement framework. And that framework was the winner of the last year's CIMNA Excellence Award, hence why we're all in this webinar. So the focus of the CIM framework allowed GDA to determine whether the services are achieving their intended outcomes for clients, their families, and their caregivers. Importantly, it highlights where things could be better so outcomes can be improved. And this was a key focus of the work. And I think Guide Dogs Australia's commitment to this should be commended. It really was their North Star and their guiding light was around understanding the outcomes of the work and then identifying areas for improvement. The framework also enables the organisations to communicate the outcomes of their work to external audiences in a way that both is compelling and evidence-based. So this increases the confidence of donors and grant providers, the NDIA and other funding bodies in the services themselves. And at a strategic level, the framework enables each organisation to attract new funding and diversify funding sources. So while this is a benefit of having the framework, it's really important to note that the primary purpose of it was the former thing I mentioned around understanding if the work is achieving the outcomes and then working to continuously improve those outcomes for people with low vision and blindness. So the structure of today is going to be, as Laura mentioned, a panel discussion that will go for an hour, and then we have 15 minutes at the end for audience Q&A. So I'll be in the chat for everybody, so please send your questions and comments through to the chat as you think of them. So I'll be moderating that, responding, and there'll be a discussion going on there. But we're also really keen to hear your questions and respond to those. Whether you're able to stick around for the 15 minutes or not, we'll still be asking those and having that discussion, and this is recorded so you can tune in afterwards. So I'm really looking forward to hearing more from the panelists today, and I'm going to hand over to Amber from the Sydney CIMNA Organising Committee, who'll be chairing our session. Thanks, Amber.
Hi, everyone. It's good to be here. So I'm going to introduce our panel. So we have Alicia Roberts from Guide Dogs Queensland. Alicia has over 20 years experience in retail and for-purpose sectors. Alicia is General Manager of Client Services at Guide Dogs Queensland, a leading provider of life-changing services for people with low vision or blindness. And we have Karen Carrigan from Guide Dogs New South Wales ACT. Karen is currently an Area Manager at Guide Dogs New South Wales ACT, overseeing a multidisciplinary team of practitioners who work with clients to achieve their vision rehabilitation goals. She's an orientation and mobility specialist and a qualified access consultant by background. And then we have Sam Cooper from For Purpose Evaluations. Sam led the Guide Dogs Australia Social Impact Measurement Framework for Purpose Evaluations, working with the team across the country since 2022. Sam is a social impact evaluation and strategy specialist with experience in local council, state government, consulting and not-for-profit contexts. And we also have Shelley Panian, Guide Dogs Victoria. Shelley is Client Vision Services Manager and is an experienced senior manager who leads the therapy services at Guide Dogs Victoria. With an extensive background as an orthoptist and an orientation mobility specialist, Shelley enjoys supporting people who have low vision or blindness to achieve their potential with goals important to them. So we now have some questions, and the questions are going to take us on a bit of a journey, starting out with how things got started and then getting into some more detail and some advice. So Sam, I'm going to start with you. Could you please give us an outline of the steps you took to create the framework and tell us a bit about what makes it so special?
Sure, thanks, Amber. So I guess in terms of the steps that we took to develop the framework, often we want to jump straight into how are we going to measure our impact. But what was really important for this project was quite an extensive discovery stage, focused not on how we're going to measure our impact, but why does Guide Dogs want to measure their impact, and what's the impact that they're trying to have. So this step or this stage of the project involved a lot of consultation across the 4 organisations, interviews with the service leaders, with the CEOs, marketing teams, workshops with staff in all 4 states, focus groups with staff, and some client interviews and observations as well, to help us put together why is it important to measure Guide Dogs' impact, and to put together that theory of change or the outcome pathways that it is intended to measure. And what came out from that stage, we had a draft purpose statement and some draft outcome pathways, and then we went through a process of refining those. So we're like, here's all the things that you said you want to be able to do. Which of these, and we had a conversation with a lot of people on this call around which of these is the priority, which of these is most important. And as Eleanor mentioned, the number 1 priority was around understanding, are we having the impact that we want to? So before we think about communicating that to an external audience, communicating that to clients, to staff, all these wonderful things that Guide Dogs can do now with the framework, the first and most guiding star or North Star, as Eleanor said, was, are we actually having the impact that we think we are, that we're hearing with that we are? Can we have a little bit more evidence behind that? So once we had that down pat, we then went into refining all of these outcome pathways that we had developed based on the consultation to look at which of those are actually a priority to measure to help Guide Dogs to know, are you having the impact that they intend to? So we looked at which of the outcomes meet the purpose, which of the outcomes are strategic to measure, which align with the NDIS outcomes framework, which are consistent across all 4 organisations, because I think the important thing to remember here is there's a lot of similarity between the 4 different states, but not every state delivers the exact same services in the exact same way, given the context of their communities. So we went through a process of prioritising those outcomes with the project working group and with a group of staff called our champions as well, and put that together into a theory of change that has a systems approach as well as a focus on the core part of Guide Dogs business. So we got halfway through the year and we were like, okay, now we can start to think about how we're actually going to measure this. Now that we know what we want to be able to interrogate and explore, how are we going to do that? So we went through a process of identifying what was going to work, what was appropriate for the cohort of people that Guide Dogs work with, which is people with a whole range of different vision impairments and blindness, people with additional disabilities, people in cities, in regional areas, what's going to work across all these different services and states. And we came up with a series of tools. So there's a client survey that's customized for Guide Dogs around the change that they're aiming to create and some of the ways that they see that happening. And there's also a validated external tool, so the Personal Wellbeing Index, which provides a bit of rigor to the framework, or a little bit more rigor. There's interviews and focus groups to have that mix of qualitative and quantitative data that we knew was important. And also some tools working with different perspectives, so families and caregivers of clients, as well as clients themselves and staff too. And then we weren't just like, okay, great, here's your tools. So we went on a process of developing the how to use these tools with staff and clients. We had a review of them with our champions group, staff in each state, and a group of clients as well. And we looked at how we can use these tools in each state. So as I mentioned, each state's a little bit different. And we wanted to balance the rigor of having the same approach across the organisation to build up into this consistent story of Guide Dogs Australia, but also balancing that with the different states' needs. So, for example, in Queensland, some of the staff were really keen to use the staff observation, which is great, and there was enthusiasm there, and so Queensland went ahead with that. Whereas in South Australia, they just put a different observation for a different purpose. But we were like, okay, we don't need to do the staff observation there and complicate the picture. So we did a process of working out what was going to work in each state, piloted it in 2023 with a focus on just one tool and a couple of others. And then the second half of 2023, we went through a process of iterating and improving the framework based on that pilot. And it's definitely not over yet. I see someone's asked how long was the entire process from start to finish. It's not over yet because this is an ongoing process, an ongoing program for Guide Dogs. So they're using the tools this year, again, currently in data collection. There's people on the phones doing surveys at the moment. And very excitingly, this year we're using